Hey, Wealth Warriors, are you ready to redefine wealth and master your money mindset? Welcome to Women of Wealth. I'm your Gen X host, Hollywoods Gray.
And I'm your millennial host, Allie Ramo. Today, we're talking about the biggest heist in American history. It's not happening at the bank, it's happening in your company's benefit package. We're breaking down why you're overpaying healthcare and how you can stop the bleeding by turning those wasted dollars into retirement wealth for your employees.
Yeah, so think about this. You go into a restaurant, you have a dinner reservation with your sweetheart, and when you get to the hostess stand, they say that'll be $20. You pay your $20 and they escort you to a beautiful seat with a beautiful view. They hand you the menu. There's no prices on the menu. However, you still decide to order. You order and you have a wonderful dinner. A couple hours later, after dessert, after drinks, after those after dinner cocktails or coffee, you ask for the bill. And the wait staff, he or she says, we'll bill you. We'll send it to you. We'll send you a bill. You're going to send me a bill for dinner? Yeah. Well, how much is it going to be? Oh, well, that'll all be in the bill. Uh, okay. And the other thing about that is you're going to have to pay it in a 30-day period. Well, my friends, that right there is our healthcare system. You have something happen, you go in, you pay your copay, and then you never know what that next bill is going to look like. I recently had lunch with somebody, and they're young, in their early 30s, and single, and their deductible before their healthcare pays anything. They pay like $500 or $600 a month on top of what their company pays, and their deductible is $12,000, $1,000 a month. And they're like 30, no health issues. There's no way they're going to hit that deductible every year, along with paying for health insurance.
Yeah, and I mean, I recently had an experience. I had troubles going through. We're going to talk about the Great American Healthcare Heist and the book that we've read, but I had trouble getting through it because of a recent experience that I was so frustrated. Every time I opened this book, I got more and more frustrated at my situation because I had been going and getting ultrasounds for free, just paying the copay at the doctor, and then I needed a specialist visit. And knowing what I knew, I called and I said, am I going to pay a facility fee to go to the specialist? I'm booking this appointment. They looked at my health insurance. They said, nope, it's covered. And I said, are you sure? I'm not going to be billed as an outpatient hospital, any type of extra other than my copay. Nope, it looks like it's covered under your care. Okay, well, to me, that means I'm not paying anything extra. However, 2 weeks later, I got a $2,000 bill. And I mean, I know so many people in America have had something similar happen to them on a bigger scale because $2,000 is nothing when it compares to stories that I've heard. I mean, reading the book and just having conversations, you and Bobby with Jackson, and you hear all these stories, and I just wonder, how have they gotten away with this system for so long?
Well, it's crazy, right? I mean, a very real example is my mother-in-law has cancer. She has the kind that's not curable, and every month she takes medication. Well, it's $13,000 a month for this medication, and then now she gets a rebate back to where she's only paying like $300 a month now or something like that. But somebody is still paying for that, either her insurance company or the prescription company or whoever it is that is issuing this rebate. Someone is still paying for the cost of this medicine. Now, of course, the medicine, I'm sure it's made much cheaper than that. However, some of these prescriptions, some of these procedures, some of the billing, it just isn't correct. And, there's a lot of fraud built up in that as well. But we're going to talk more about that. So, Allie, why don't you share a little bit about the Congress hearing that happened in January and some of the questions that came up out of that?
Yeah, so Congress, their Ways and Means Committee had a hearing with the top executives from the big healthcare providers. So Cigna, um, United Healthcare, Elevate, Aetna, and I don't remember who it was, but they asked a few different questions and asked these executives to raise their hand. So they said, raise your hand if your company owns or controls a health division. So that's like healthcare facilities, doctors, things like that. Can you imagine all of them raise their hand?
Yes.
Shocker.
Right.
And that's a picture of, they're not just health insurance companies, but they're the facilities that you're getting care from. So they're the biller and the payer. So how does who's going to actually pay in the long run? The patients.
Right.
Another question was, raise your hand if you own or control a pharmacy benefits manager, otherwise known as PBMs. And again, all of them raised their hand. What does this mean? They're the middleman from the pharmacy to the insurer. And so they are handling the cost of your prescriptions. So again, when someone is in charge of the costs, who's going to lose in this situation? And in Hawley, in your situation, when you said your mother-in-law was getting a rebate, well, the PBMs, they'll have rebates on medications, but they're not telling the patients, they're not telling the employers, and they're actually getting the rebate themselves and charging the employee the full cost of the prescription. So again, where is this money circling in and out of? It's going to them. The last question I noted was, raise your hand if you lead a publicly traded company and have a legal responsibility to maximize profit.
And every hand went up.
Every hand went up. And that's like their sole goal is to maximize profit. It's not to maximize health. And yet they're supposed to be health insurance companies. They're supposed to be the health divisions, the health facilities.
Yeah. And in this book that we were reading, The Great American Healthcare Heist from Chris Deegan, the other interesting thing that she shares, just story after story of how these hospitals and insurance companies are one and the same. But also the other thing that is mentioned, which wasn't mentioned necessarily in this for-profit situation like Allie's talking about, but there's a lot of hospitals that are nonprofit. The nonprofit starts out, sounds like it's a good way to help people. However, they're getting millions, if not billions of dollars in tax credits, these hospitals are, and then they're providing about 2% of those tax exemptions to the people who really need it. So the low income or no insurance, or people who are struggling to pay their deductibles, they go in with a major medical crisis and they're not getting access, or they're not being told about the services that are provided. And it's really that nonprofit's responsibility to help the people in their community. That's what they were chartered for. That's how it used to be. And so it's going to be interesting to see what happens over the next few years when it comes to healthcare. I do think there's going to be some major changes. I know that, the light is getting shown on it, just like it did back in the late 2000, when the market crashed. There was a lot of rules and regulations that went into the industry that we primarily serve, which is educators. Before 2007, 2008, one thing that happened in schools is there was about 240 to 50 providers within the schools. Now there's about 30 providers. And the reason why the number went down is because all of these companies that are now able to provide products to the schools have all been vetted, and they all go through their third-party administrator. There's no oversight committee for health insurance yet. This is coming by these interviews and stuff that are taking place in Congress and the Senate. These overviews are coming, but right now it's kind of like the wild, wild west out there. People go where they can get the lowest premium, and a lot of times that might not be the best service or the best place for them. So, we believe that Wealth Care, which is a new offering that we're going to be providing, we believe that this is going to help solve some of those questions that are out there. Do you remember in the book, Allie, when they talk about, the challenge of getting like an expert doctor or a specialist? They talk about how, you have to jump through all these hoops to get to a specialist. And then at the end of the day, they're still denying some of those claims.
Yeah. Yeah. And now using AI to deny certain claims as well automatically without actually seeing human hands, and they're wrongfully being denied, and people have died because of this. It's insane. And Holly, you had mentioned, these hospitals are supposed to be acting as nonprofits and getting tax credits. I mean, they're also not having to pay property tax. That's part of being a nonprofit. And those property taxes go to fund schools. So I mean, we're helping teachers on one side and
Yes,
and they're
exactly.
avoiding funding the schools on another side. That really got me. And with low income Americans, that there's all these programs that do exist, yet no one knows about them. I didn't know about them, and my degree is in public health. That's kind of been It's been exciting for me to dive into this because I had the background. My favorite project in college was creating a your perfect healthcare system. Now, that was over a decade ago, so I don't remember the kind of healthcare system I created, but I loved learning about it, and the creativity of, okay, what would it look like for America? I remember loving to do that, and then working at the California Department of Public Health and just kind of seeing how slow change happens, and being exposed to wealth care and now being a founding relations manager. I'm excited to put this in businesses' hands because I really think it's going to change for employers, for employees, getting access to quality, affordable healthcare, and something that people, a lot of things prevalent in America is that people avoid healthcare because of cost, because of fear of cost. So they're avoiding going to the restaurant because they don't want to be hit with a surprise bill because they don't know what the food costs or the drinks costs. So they don't go and they decide to cook at home. Well, their appliances are bad at home, and now there's a giant fire, and the fire department has to come and put out a fire. And that's a metaphor for heart attacks happen, strokes happen because they're not going to preventative care. And that's just one thing that wealth care solves, is that it's giving access to upfront preventative care.
Yeah, I mean, it's really sad because you hear people about die from cancer, and usually it's because they didn't catch it early enough. Most cancers nowadays are treatable if they're caught in the early stages. Not all of them, but most of them, right? And so if you catch it in a stage 1 or even a stage 2, there might be some treatments that can be done, but people are afraid to go get their preventative screenings, their colonoscopy, or their mammograms, or whatever the case might be, and they wait until it gets to a place where now it's urgent and it's an emergency, and now they're having to go through chemotherapy, radiation, all these things that cost more and more money, but also do so much damage to the body as well. And the other thing that our healthcare doesn't do is it doesn't provide alternatives, right? So I have a friend, they've spent about $250,000 on the treatment of cancer in the husband. And he's been to Austria to have treatment done. He's been getting all kinds of alternative treatment. He is taking a chemotherapy type medication, but it is about a tenth of what he would get if he went to a regular hospital here. It's more with a natural path, and they have different, vitamins and whatnot that they're putting into his system to help fight these cancers. And I was even reading an article recently about how the GLP-1s can help treat certain kinds of cancers, as well as obesity and all that. So, I mean, there's a lot of really great research out there and a lot of really great solutions to a lot of the problems. But the challenge is, how do you get access to those products if you don't have a way to go to the hospital, go to the doctor, get, primary care, or get alternative care? So I'm really excited about wealth care too, because I think it does open up the preventative and the wellness side of things, help people get healthier from the inside out. What they put in their mouth is like usually number one. And so I'm going to go ahead and pull this video up. I haven't ever shared on a podcast before. I haven't ever shared a video file. So let's see how it goes.
Healthcare costs keep rising. Premiums have grown 3 times faster than wages, and employees are opting out. Meanwhile, 1/4 of U.S. healthcare spending is lost each year to unnecessary care, billing errors, and fraud. And retirement security is in crisis. Almost 60% of Americans have less than $10,000 saved, even after decades of work. The healthcare and retirement systems are broken. WealthCare is our attempt to rebuild them, together. A patent-pending system that turns better health into automatic wealth. Healthcare that pays you back, with zero out-of-pocket costs and no disruption to your existing health plan. Employees receive meaningful benefits, including $0 copays for urgent care, primary care, virtual care, and mental health counseling. Free lab work. Zero-cost prescriptions, because we own our own pharmacy. A free bill reduction service that lowers medical bills by an average of 70%. At least $1,100 per year deposited at no cost into their pension, and $1,300 to $2,800 per year to spend freely in our store. All it takes is just 2 minutes a month of self-care. Employees scan and instantly earn rewards, with automatic deposits into their store account and pension. Employees love WealthCare, and they love the employers who offer it. So how does the employer win? WealthCare works alongside your health plan and is used first. There's no deductible, no out-of-pocket costs. So employees naturally choose WealthCare before filing claims, reducing utilization and lowering premiums over time. When medical bills do arise, employees are incentivized to reduce them. They use our bill reduction tools to lower costs by an average of 70% and earn additional store rewards every time they do. Fewer claims, lower claim amounts, less waste. Most importantly, employees get healthier because every self-care action is instantly rewarded with pension contributions and free store money. Better care, lower claims, higher retention. Sounds too good to be true? Here's why it works. The government wants illness caught early because prevention costs far less than chronic disease. And they reward companies that offer retirement benefits because Social Security alone isn't enough. WealthCare's patent-pending system does this automatically and compliantly. And remember, there's no disruption to your current health plan. With zero out-of-pocket cost for the employer or the employee, this isn't insurance as usual. Join us in fixing our broken healthcare and retirement systems.
You can reach out to myself or Allie. We'll have some reach out information in the show notes. This might also be a good time for, if you're more interested in more information about this, is for you to watch this podcast on our YouTube channel. You can go to Wow Women of Wealth YouTube channel, and we'll have that in the notes as well. But this is a great program that we're rolling out. And some people ask the question, Allie, how can you do this? So would you like to answer that, or would you like me to?
So how can we do this? Like, you mean how does WealthCare work?
Exactly. How is it zero cost to the employer or the employee?
I to make it simple, I say that we're leveraging tax credits. So there's laws out there that exist already that are encouraging employees to take action towards preventative care. So I will say, and I tell business owners and employees have to do this engagement of preventative care in order to get all the benefits. You don't get the benefits without doing preventative care. And so in the video, she was talking about employees scan their face. And, we've talked about data protection and privacy on here in the past, and that's something I'm really huge about. So when I first heard that I have to scan my face twice a month into this app, I cringed a little bit. But after hearing from the people who built the technology, this thing is secure, and I would do it, and I would have my family do it. And so but you do have to engage in that preventative care in order to get the benefit, because that's what triggers the tax credits. And the tax credits are not only just providing this free coverage, but they're paying at a minimum $1,100 per employee a year into a SEP IRA account. And I think that's really cool, that it helps Americans not only pay for things in the online store, but also contributing to a retirement account. $1,100 isn't much. However, $1,100 over 30 years is a lot more than nothing, right?
Well, and also if you already have a plan in place, this can go hand in hand with that. So whether that's a health plan or like a 401k or a 403b, that's an additional $1,100 on top of whatever your company might be matching or whatever you might be contributing already on your own. And this, again, doesn't affect your check. That $1,100 is something that is a tax benefit for you, and it's a benefit that you can use at the end of each year. So it is something that is really cool that you can also get a benefit of retirement with your healthcare plan. I think those are the two biggest problems that most people would say they have when it comes to looking at their future. What happens if I get sick? Medical debt is the number one bankruptcy filings for the elderly, people who are on Social Security and Medicare. That's their number one reason why they have to file bankruptcy, is because of some sort of medical event that isn't covered. And number two, retirement. If you have retirement in place, then you don't have to just count on your Social Security. You have something else to count on. I mean, we all know that Social Security is underfunded as it is. So there's a lot of big problems that this can solve. Again, it may not be the answer to everything, but it is the answer to a few of these problems that we've been talking about today.
Yeah. And then did you already mention the 10 employees or more? I think you did.
No, but that's good to know. So it's good to know. So you want to have at least 10 employees or more, and you have to be paying into your FICA tax. So that is the Social Security tax, in order to qualify for this program. So that is what starts the tax arbitrage, is the FICA tax. So this would not be available for those people who maybe are teachers and not paying into their Social Security. So that's good to know as well. But in any case, even in California, in the public education system, there's over 250,000 employees that are also paying into Social Security. So it isn't a one size fits all program, but it does help the majority of the business owners and employees that are out there.
Sure. I'm really excited, because if healthcare, it touched on this in the video too, that if you're using this first for your health, your small healthcare needs, that means there's less claims going on your health insurance. And so year after year, we're hoping that, this lowers your healthcare costs by 20%, I think is the projected percentage year over year on. Instead of it going up, it's going down.
Yeah.
And that gives leverage to business owners to increase employee wages as well.
Yeah, and retention, and also additional savings for retirements possibly. So that 20% is a pretty big number. And most of the employees and the employers that we've met with really do want to help their employees. They want to keep them on. They love, having benefits that really help their employees. Not everyone's like that, but the majority of the people that we talk to, they're looking for ways to keep their employees happy and to give them as much benefits as possible. So again, if you would like more information on it, now, again, that video is AI generated. I just like to note that. However, it does have all of the information about the wealth care plan. We also have websites available for you to go and check it out as well. So we'll put those in the show notes. Anything else you want to add, Allie?
Nope, just reach out to Hawley or myself if you have any questions. We'll put our emails in the show notes as well, and then the wealth care website for you to check out and contact us to see if it would benefit your company.
Absolutely. Thanks for tuning in, and we'll talk to you next week.
Bye.